Sagorine, and good afternoon to you and all of our listeners today. I want to thank everyone for joining in this afternoon as we provide an update on the happenings here within the community and the MCA. So I hope all of you are continuing to do well. Yamatarine, as always, and CKON for making the time for me to update the community. As mentioned by Reen, we are streaming live on our MCA Facebook page, and it is being recorded to share later on. For our listeners, as Reen mentioned, we are only taking questions by calling in to CKON at their phone numbers of 575-2101 and 358-3427. It's now been 16 weeks, 4 months since we declared a state of emergency in our community. And I do know that dealing with this pandemic has been extremely difficult on all of us, and practicing all of the necessary precautions, especially the social distancing that continues to be in place, continues to be challenging for all of us. And I do want to say that on behalf of the Mohawk Council and myself and our council, thank you very much to all of you who continue to practice all the recommended precautions in our fight against the spread of the COVID-19 virus. For today's discussion, I'll be providing information on the MCA's reopening date. We're going to talk about the curfew change, boating and water safety, and we'll provide an update from the Eastern Ontario Health Unit. So all of the MCA employees have returned to their workstations on full-time basis as of last Monday, June 29th. At this time, the MCA has decided to delay the resumption of services and the reopening of our buildings to the public, and that is until July 20th of 2020. The date for reopening was originally set for July 6th, but we have seen that programs and staff require additional time to adjust to the coming back into the workplace, and we need to give them that time to adjust to the ongoing pandemic as well in the work and the impacts it has on our workplace. New processes and procedures are being implemented to help prevent the spread of the COVID-19 virus. Our focus is on ensuring the ongoing safety of our community and employees. Your understanding is greatly appreciated as the Mohawk Council of Akwesasne works to make certain that we are able to safely resume providing services to the community. For now, what I can say is that the community needs to be aware that once MCA facilities reopen to the public, you'll be subject to screening upon entering any MCA facility. The tools being used are being provided by the Community Health Program and currently consist of questions that are going to be asked of you. Those questions will be along the lines of whether or not you've been in close contact with anybody with acute respiratory illness, whether or not you have traveled beyond the 50-mile radius in the past 14 days, if you have any symptoms related to the COVID-19 virus, which will be read out to you, if anyone in your household has a probable or confirmed case of COVID-19, and if you've been identified as having been in close contact with a confirmed case of COVID-19. So that's where contact tracing comes into place. As well, for anyone over 70 years or better, there's additional lists of symptoms that would apply to them. For MCA facilities that have a reception, each person, employees and community members will be screened by the receptionist. If you answer yes to any one of the questions, you will not be allowed further into the building, and you'll be advised to proceed home, self-isolate, and to contact the community health nurses for further screening and advice. You will note that plexiglass barriers have been installed at every reception area within where their screening will take place. Every MCA facility also has large stickers on the floor reminding community members and individuals entering into the facility to maintain physical distancing of 6 feet or 2 meters from others at all times. It's important that our community members continue to exercise all the safety precautions put in place to limit the spread of the COVID-19 virus, whether it's in your home, within the community, or within one of our MCA facilities. For MCA facilities that do not have a reception, for the time being, employees are being required to self-screen by filling out questionnaires. We are currently working on how screening will be accommodated in these facilities when MCA reopens to the community members. On June 29th, 2020, the Mohawk Council of Akwesasne passed a resolution to amend the Akwesasne emergency curfew law to change the hours of the curfew, which was from 10 p.m. to 6 a.m. It is now 11 p.m. to 5 a.m. While the curfew hours have decreased by a total of 2 hours, the maximum travel radius of 50 miles, which is 80 kilometers outside the community, continues to remain the same. The reason we have kept the travel restrictions in place is that because the community safety is our council's top priority. There are areas that are just outside of the travel radius that still continue to experience high numbers of confirmed COVID-19 cases, especially in the nearby city of Montreal, which we all know is a hotspot and continues to be continued to be avoided for the entire community's safety. I just want to share some of the numbers of the cases in the surrounding areas of Akwesasne, and these are as of Monday, which is yesterday. The Franklin County has tested 33 positive cases out of 8,247. St. Lawrence County is 226, has had 226 positive cases out of 19,000 tests. Eastern Ontario Health Unit, 164, has had 164 confirmed cases. 23 of those are in the Cornwall area, and they've tested approximately 18,000 people. Ottawa is 2,036, with 170 of them being recovered and 260 deaths in the city of Ottawa. And Montreal is 27,428. They've had that number of confirmed cases. So you'll see that the number of cases in Montreal is alarming. And the other area is Ottawa is significantly higher as well. During my last update, the community wanted to know about the number of tests that have been completed to date by our Department of Health in our community. In April, we had 20 tests were completed. In May, another 20 tests were completed as well. In June, there were 64 tests were completed. So in a total of 104 have been completed by our drive-through testing unit. And all of those have come back negative. There's no positive cases that have been tested in our community. I do also want to offer, though, that the testing center in Akwesasne was a mobile unit, but it means that we can move that unit around to the districts if needed to be set up to be tested there. It does not mean that testing will be done in your home. We will not go door to door, so it is a drive-through testing unit. The work of our Department of Health, our EOC, council, and every community member who has been abiding by the emergency measures that have been put in place is the reason why our confirmed number of COVID-19 cases is low. And we really want to keep it that way. Yamagoa to you and all of our community for cooperating and keeping our community safe. With the beautiful summer weather that we're experiencing, I want to remind our listeners about boating, water and boating safety. Akwesasne has abundance of water, of which our community actively uses for fishing, recreation, leisure throughout the summer months. And for the safety of everyone, especially our children, we need to remember the water safety basics. And that's about wearing a life jacket, acting by going for help if somebody is in need and trouble on the water, take swimming lessons, educate yourself on swimming safely in the water trends, and respecting the rules. These are some important basics that we need our youth and young ones to understand. In addition, always swimming with the buddy and never leaving children alone unattended while swimming is extremely important. Swimming safely covers a lot of ground. Basically, be aware of your swimming abilities and where and how, and when is it safe to swim. If you feel your swimming skills could be improved, take swimming lessons. Don't ever swim while intoxicated. Avoid swimming when it's dark, and stay in sight of others. The rules that need to be respected include safety, water safety rules, boating safety rules, and obeying all posted signs. For the signs, this goes for both beach safety and environmental signs. Taking a look around you, does the weather seem safe for swimming? Lightning and water do not mix very well, especially when you're caught in the middle of a storm. High winds can cause conditions on the water that may be unsafe. So we want to ensure that folks are checking the forecast ahead of time before heading out on the water. And keep an eye out for hazardous signs on the beach itself, such as warnings of sudden drop-offs, dangerous marine life, and strong currents. And around safety and training, learn how to safely operate and navigate a boat safely is important for both you and your passengers' sake. Taking boating lessons and certification courses can also reduce the risk of accidents, injuries, and death. Life jackets, as you've probably heard, that there's a little rule 1,000 times is that it's still worth it to wear a life jacket. Wearing a life jacket may feel cumbersome, but it also makes a difference between staying alive and becoming a statistic. Again, paying attention to the weather, extremely important. Okay, you don't want to be caught in a boat in a storm that could have been avoided of being out in the middle of the St. Lawrence. And avoid alcohol. Drinking alcohol in operating a boat can be extremely dangerous. Driving a boat under the influence has a similar risk to driving a motor vehicle while under the influence. Impairs one's visions and decision making and the ability to respond quickly if needed. And it's also illegal. And mind your health. For those folks that are out on the boat, need to continue to ensure that they're not getting sunstroke. Stay very well hydrated, drink plenty of water, wear protective gear, and don't push yourself past your limits. Finally, in boating, the precautions around social distancing still continue to apply on the boat, in the waters, including the marinas and the boat launches. This is extremely important. As well, to our non-Indigenous listeners, travel between Canada and the United States is limited to essential travel only, and that continues to apply on the water as well. Finally, I want to give an update on the information to the community on the recent updates from the Eastern Ontario Health Unit. The Eastern Ontario Health Unit is the local health authority that the MCA works with to ensure that we are protecting the community in accordance with the recommended and mandatory health requirements. As of June 12th, the Eastern Ontario Health Unit has allowed indoor and outdoor swimming pools and outdoor splash pads to open to the public as long as there is no access to high contact areas such as slides and climbing structures. Outdoor recreation facilities that operate low contact attraction activities are also allowed to reopen. However, indoor recreational activities are not permitted. What does this mean for Akwesasne? It means that social distancing continues to be extremely important. If you choose to participate in an outdoor activity in Cornwall, Messina, or surrounding area, please ensure that you continue to maintain physical distancing of 6 feet and 2 meters. And that also includes in our community as well. We are currently preparing to send letters to each of our recreation center committees advising them that if they wish to allow activities to take place at the recreation centers, they would be required to submit a resumption plan that includes the safety precautions that they will be putting in place to keep the community safe. This is not to say that they must reopen, but if and when they're ready to open, they need to be able, each respective committee needs to be able to submit a plan. This is for both indoor and outdoor activities. At this time, the recreation centers each remain closed, and community members should not be participating in any unauthorized activities at these centers. The letters to the centers will be sent out this week, and any recreation center committee that wishes to allow activities to take place at their centers will be required to submit their plans to the MCA Executive Director, who will be consulting with the Department of Health and Emergency Officer to determine whether or not the plan should be approved. Please keep in mind that these continued precautions are in place to promote the ongoing safety of our entire community. Your understanding is appreciated. In addition, our daycare facilities, including their playgrounds, can remain closed at this time. Another important update from the Eastern Ontario Health Unit that I want Akwesasne to be aware of is that as of today, masks are mandatory in public indoor spaces in Cornwall, as well as across the 4 health units of the Champlain-Linz area. According to the Eastern Ontario Health Unit, masks offer a source protection, which means that they prevent a person wearing a mask from spreading the COVID-19. This is the thinking: if you wear a mask, if I wear a mask, I protect you. And if you wear a mask, you protect me. If everyone wears a mask, then everyone is protected. We have done well locally thanks to the many measures that we have taken, including limited gatherings, physical distancing, always washing our hands, and keeping good hygiene. And now the tool is being added is masking. This is a new directive was announced by the East Ontario Health Unit yesterday and is effective today. To be clear, it applies to indoor enclosed public spaces accessed by the public. However, the directive was issued by the East Ontario Health Unit under the Ontario Emergencies Declaration and is enforceable by police, bylaw officers, and public health inspectors in Cornwall. I'm sharing this information with you so that you are aware of the measures in place when you travel to Cornwall for essential reasons. As well, you can expect that when you come to the MCA facilities in the public areas, meaning the entrance areas, you'll be required to wear a mask as well. Reen, that is everything I wanted to share with you and the community, an update in the form of an update this afternoon. I welcome any questions from you or any of the community at this time.
Thank you very much. Again, that's Grand Chief of the Mohawk Council of Akwesasne, Abram Benedict. You are listening to a live edition of Didawatala. The original air date of the program live is Tuesday, July 7th, 2020, and covering the Mohawk Council of Akwesasne's response to the COVID-19 pandemic. So if you have any questions about the Grand Chief's presentation or anything else having to do specifically with MCA's response to the COVID-19 pandemic, the CKON phone lines are open, and they can call 518-358-3427, 613-575-2101. So we do have a few questions that have been phoned in already. We are looking at the fact that the City of Cornwall and throughout the Eastern Ontario Health Unit, they are requiring masks as of today. And we have a listener who would like to know, are there going to be masks available for free for people who cannot afford masks?
We have not made a decision on whether or not we're providing masks to community members. I think that thus far we have seen that masks have already been required to go into Messina, Malone, and surrounding areas. It is something that we can look at. I know that people have been selling the masks online as well. There have been a number of donations made to the healthcare providers. So it's something that we can look at to be able to provide to those who are not able to afford them. But if there are those individuals who are on assistance to the Mohawk Council, they should speak to their worker there as well to see what's available. But at this point, no decision has been made whether or not masks will be provided to community members to be able to help with the costs on that.
And another question with regards to the curfew. Actually, sorry, not the curfew, the travel radius, I should say. So we have a listener who would like to know if you could please clarify on how the 50-mile, 80-kilometer travel restriction radius for the Mohawk Council of Akwesasne versus the 100-mile travel radius restriction for the Siverages Mohawk tribe. So the listener says, for example, if someone from the American side goes out to Lake Placid or the other way that's within the 100-mile radius, is that person able to come into Siverages, Snai, or Gowanogay since it's a 50-mile radius for us? Or does the 14 days of self-isolation or quarantine come into effect before they can come over to those three districts? And I want to clarify that this is for someone that lives on the American side. So if somebody who lives on the American side travels to Lake Placid or Watertown or wherever within that 100-mile radius put out by the tribe, can they come into the three districts under the jurisdiction of MCA without quarantining for 14 days?
The curfew and the travel radius was put in place to protect the community from being exposed to areas that have high rates of positive cases of COVID-19. So the Mohawk Council instituted a community curfew law that also speaks to the travel radius, which was applicable to the jurisdiction of the Mohawk Council. So if the individual who may reside on the southern side travels outside of the 50 miles, those directives have been provided by the Siverages Mohawk tribe, which is allowable. But if an individual who works for the Mohawk Council and resides on the American side travels outside the 50-mile radius, they are subject to the policy directives of the Mohawk Council because they're an employee, and then they would have to quarantine for the 14 days. Now, I know that this has been extremely challenging as well as a number of the other directives and precautions put in place, but this is to limit the risk of our community as a whole. We have seen that the positive cases that we have seen on the southern side of the community have generally been related to people traveling to the community, or traveling outside the community or coming into the community. And we're continuing to monitor this weekly. In fact, our council meets on Mondays now virtually. We have a call on Wednesdays to receive updates as well related to the COVID. We're continuing to monitor this. If the numbers continue to plateau and go down within the regions, we will take necessary actions to perhaps expand that travel radius. But the biggest concern is that Montreal is within a very short driving distance, and for all intents, purposes, and argument's sakes, they have really taken an approach that's is a bit concerning to us. So we want to make sure that we're staying safe. So we only have the authority to provide direction for members under our jurisdiction. Tribal members should be abiding by the restrictions put in place by the Mohawk tribe.
All right, again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict. This is the question and answer portion of today's presentation. Again, if you have a question for the Grand Chief specifically related to MCA's response to COVID-19 pandemic, you can call us here at the station 518-358-3427, 613-575-2101. So let's get to another question here. Looking at the community health program that is working the mobile testing site for the Mohawk Council of Akwesasne. If your community health program ends up with a person who does test positive, will that information be released immediately, as an example, as the Siverages Mohawk tribe did with the first Akwesasne to test positive in Franklin County? Will that be something that is shared with the public immediately if and when that were to happen?
Didn't realize I was on mute there. Sorry, Renee. We have had a couple conversations within our health department about this. So the community health nurses through the Mohawk Council work in partnership with Eastern Ontario Health Unit. So the way that the numbers are reported now, they're rolled into Cornwall's numbers. They were not broken out specifically to Akwesasne. Now that we have not had a positive case in our community through our testing center, we hope that it continues to be that way. I mean, that really is in each individual person's hands, whether or not, that we get a positive in our community. If we do, it is something that we will have a conversation about at that time. But, a decision has not been made whether or not that will be immediately announced. The numbers would be rolled into the Eastern Ontario Health Unit's numbers. It's not I can assure you that this is not going to be a secret. I mean, we don't want to keep things secret. We continue to receive questions, online and on social media saying, well, why are they not publishing the numbers? Well, why, are there any cases? There are not any cases right now. The numbers I've shared the numbers earlier on all of our updates. We shared the numbers that of the people that are coming through to our testing centers. But we'll take that forward, with the health administration to determine, what sort of announcement will be made if we have a positive case under our jurisdiction. Let's continue to work towards not having one, and that's ensuring that we are taking care of ourselves and ensuring that we're following all of the safety precautions necessary.
All right, taking a look at another question. Is there currently a burn ban under the jurisdiction of the Mohawk Council of Akwesasne?
We had provided previously this information that we had been working with the Sandwich Mohawk Tribe and the Akwesasne Volunteer Fire Department about a burn ban in the community. That still continues to be in place, but that is for large burns, i.e. burning marshes, burning yards, things like that. Small controlled fires in devices that are meant for burning is allowable, but there isn't. If people should not be burning large bonfires or burning grasses at this time, especially right now. It's been extremely dry in the community. We have not had a lot of rain, which just ups the risk to having a fire get out of control. Initially, when this had started, it was because we wanted to ensure that a fire that was set and got out of control unintentionally now draws all the firemen to the scene to put that out, which means they're congregating. You don't know, if the person they're attending to their site may be carrying the virus. That's how we had started. Now, it continues to be in place, but it is extremely dry out there, and we really should be not burning large fires. They need to be in burn, burn structures, small burn barrels and things like that.
All right, our next question has to do with an essential worker. The caller says the essential worker is the wife who works for Mohawk Council of Akwesasne. Will she have to quarantine if her husband travels outside of the 50-mile radius, 80 kilometers, as part of his job? So again, it's an essential worker. She is the wife in the couple, and she works for MCA. Will she have to quarantine if he travels outside the 50-mile radius as part of his job?
I'm sure that there are other members in our community who are working away. That's quite essential that people need to continue to provide for their families. That may, their employment may be outside of the community, outside of the 50 miles, or in the tribal case, outside of the 100 miles. The community law says for that individual person needs to be quarantining in their home when they come back into the territory. Now, I would expect that, community persons take all necessary precautions to ensure that they are not exposed, that they are not bringing additional risks to their family members at home. As well, a number of employers have put in mechanisms and precautions in place to protect their employees. We're not in a position to tell people that they need to quit their job outside of the community because of needing to quarantine. Now, we do expect them to do, to take all precautions necessary. When they come home, they need to be, staying within their homes and not exposing themselves to the community at large.
All right, we're continuing with questions for the Grand Chief. We're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict, and these questions are specific to MCA's response to the COVID-19 pandemic, for MCA as an organization, and also for Akwesasne that live under the jurisdiction of the Mohawk Council of Akwesasne. So next caller says MCA received funding from Canada for COVID-19 relief. What sort of perks, if any, will be distributed to members on the northern portion of the territory, just like the Siverages Mohawk tribe, handing out cash, paying the broadband, the AC units, etc. So that question again for MCA, receiving funding from the Government of Canada for COVID-19 relief. Will they be distributing funding and opportunities to pay electric or broadband AC units like the tribe?
The Mohawk Council has received some additional fundings from the federal government and the provincial governments in relation to the expenses related to the COVID-19. I had provided a report in our previous updates to the community on the exact numbers. I can tell you, though, that a significant part of the monies that we received went to the garden project. We've provided over 300 raised gardens to the community. Those were an initiative of a sort of food security. So that was a direct benefit to the members that may have signed up for that. I know that we have been asked whether or not, we're providing direct benefits to community members in the form of cash payments or check payments to them directly. I do want to remind folks, though, that the Mohawk Council had not laid off any of our employees. We had a number of employees that went home. We have upwards of 600 full-time employees. At least half of the workforce went home. Nobody nobody lost their paycheck as a result. So I believe the design of the stimulus was to assist those community members who had direct financial impacts related to COVID. Anybody in our community that may have lost their employment related to COVID, whether it be within the community or outside of the community, CERB was available to them, and it continues to be available to them. So we have provided information to community members on that. Additionally, the monies that we receive have gone to ensuring that the workplace in which serves our community is going to be safe upon their return. So the plexiglasses have been placed. There have been some building modifications that had to be done. That was another area in which those expenses were tagged to as well. So those have been some of the bigger items. The food distribution as well was a very large item that had a financial cost to the organization, in which we provided hundreds of food packets to community members in the form of delivery to their home, as well as in the form of pickup. So that has been a direct benefit to community members. Going forward, if there is a second wave, we will look to restore perhaps some of those programs that we had. But at this time, there is no plans to provide direct payments to community members in the form of, financial cash payments to community members.
Okay, before we get to any other questions, I do have something I want to pass along since we do have a large listening audience, especially under the jurisdiction of MCA, and for those that attend the AMBI schools. Akwesasne Mohawk Board of Education is asking that all Chromebooks that were distributed in the spring for the 3 AMBI schools and also for the high schools in Cornwall please be dropped off at the AMBI office located behind the Peachtree Mall. They are open 8 a.m. to 4 p.m. Monday through Friday. Please make sure that the chargers are with the Chromebooks. Yohahio in Akwesasne is also a drop-off location for those who cannot make it to the AMBI office. If you can't make it to either location, call Guzzy, 613-933-0409 to make arrangements for pickup. We're talking with the Grand Chief of the Mohawk Council of Akwesasne, Abram Benedict. We have another question, Grand Chief, from a listener. Now that the Eastern Ontario Health Unit is requiring masks, are MCA employees and visitors to the MCA facilities going to be required to wear masks?
So the way the orders have been written is that it's in public places. So not all areas of MCA facilities are public. So when community members come into a facility, they will be screened at the reception area. They will be required to wear masks. The public community members coming into the buildings will be required to wear masks. Staff at this point have worked with management to ensure that physical distancing continues to be respected in the workplace, that staff are not close to one another, so that they are able to safely work at their workplace. They will not be required to wear a mask. Now, if staff are going to be interacting with community members in public places, yes, they will be required to wear masks. The reception areas that have plexiglasses, those staff will not have to wear masks. So there are some other modifications that have been done that are in those orders that say specifically if they're behind glass, it's fine. But community members generally coming in will have to wear masks.
Okay, so I do have another question from one of our listeners, which falls in line with one I just asked. I just want to make sure that you're aware of it, Grand Chief, so that we know our caller knows that we've asked, and you've already answered this one. The tribe received monies from the CARES Act for community members. Does MCA have anything similar they can look into or are actively working on? So for the funding that we've received already, you've answered that question. Is there something in the future or something that you are working on that would fall in line with that?
Yeah, those monies that have been provided have been, and monies provided generally have been designed to assist persons who have suffered financially from the COVID, usually have had job loss. Going forward, we will continue to look at what options may be available to provide to the community should we have a second wave, or health experts are saying we will have a second wave. We will look at what may be available then. But again, those supports have been provided in the form of the garden boxes, the food packets that have been delivered, as well as making modifications to the community buildings to be able to continue to reopen and continue to serve the community safely, have been the three target areas of most of the additional resources that we have received. Again, the no employee of the Mohawk Council was laid off as a result of the COVID-19.
All right, taking a look at testing. Going back to that, why are you not, caller wants to know, why are you not requiring MCA employees to be tested for COVID-19 before returning it to work? Is there a legal issue that prevents this from happening? What is the reasoning behind not requiring MCA employees to get tested for COVID-19 before your organization reopens to the public?
So all of the employees have returned now, so they are back in the workplace. The plan to reopen the doors publicly to the community so that they can come in to receive services is going to be on July 20th. The administration, in collaboration with our health department, has made the decision that testing will not be done unless it is required in certain areas. I do believe that some of the healthcare workers, actually, I take that back. All of the healthcare workers were tested as part of the keeping the Junkanusada and Yakisuta safe. All of those workers were tested. If employees are found to be leaving outside the 50-mile radius, administration has been asking them to be tested as well as part of their quarantining. The decision, really, we have to remember that a good portion of our workforce is Akwesasne people, meaning that they are in the community. So leading up to coming back to work, we really need people to be taking safety precautions seriously, so that they're protecting themselves, their community, and then ultimately the workplace and the community in which we serve. So if a second wave comes about, and as we continue to modify how we are delivering services to the community, there may come a time when that would be required of employees, but at this point it has not been made by the administration, that decision to say all employees must be.
Is there a date set for your general meeting, which will be occurring on Zoom?
Yes, absolutely. So we have set the general meeting date for the last Thursday of July. It will be occurring on Zoom. We will provide, community members will have to email or call in to get the information to participate in the meeting. That's simply because it's not generally a public meeting. It's public to our community, but not members outside of our community. So that's set to occur on July 30th at 6 p.m. The agenda has been determined that we will provide a more comprehensive report to the community on the MCA's response of the COVID. So what the organization, how we responded, what we have done. We'll talk about the financials, about the costs that has incurred to the community, and the resources that we have gotten from external, and how they've been spent. We will include that in there as well, but also reminding community members that they need to continue to practice all of the safety precautions going forward. Then, so that is the framework or the rough agenda for the general meeting occurring on July 30th, virtually by Zoom. Now, you don't have to have a computer to do this. You can call in as well. We'll provide that information to community members to listen in. I know this is not a perfect situation, but we need to continue to ensure that we are physically distancing, keeping ourselves safe, keeping the community safe, but also continuing to provide the information that's vital to the community to keep them up to date.
All right, our next question, looking at why our numbers in Akwesasne for the jurisdiction of MCA, why are our numbers not separated from the Eastern Ontario Health Unit? So again, why are Akwesasne numbers not separated from the Eastern Ontario Health Unit?
That I don't have a direct answer as to why. I think that, the numbers thus far, I think we're at 104, 106 total tests that we have been administered with 0 positives. Going forward, it is something that we can look at. Again, it kind of relates to the question that was asked earlier, whether or not, we'll provide a release to the community should we get a positive case. I really hope that we don't get a positive case, but, going forward, we can look at breaking those out. I think too, though, when we talk about numbers, there have been lots of reports about asymptomatic people who are carriers of the virus but don't know they have the virus, and then they come in contact with somebody who then brings the symptoms up. When we talk about numbers, it does to a certain degree give a sense of false security that, we don't have any risks in our community. But we can say that, Kingston, just up the road, boasted, and good for them, for, that they did not have a case for about 60 days. So then as we've seen, as they went into phase 2 in Ontario, they had a nail salons open, and 10 people were infected right away. And then now, 60 days without a case, they had 10 people. In fact, it grew to 20 as a result of contacts that happened there. So they may have been, in the city thinking that, we're doing pretty good, we have no numbers, how it happened. So we really shouldn't get fixated on, we have, no confirmed cases here, because it doesn't take much at all. And that changes very quickly. And that's why we need to continue to take all of the precautions in place to keep ourselves safe.
Another listener would like to know if MCA has the capacity to test entire families here in Akwesasne. The caller says Cornwall is asking for everyone to go get tested. Some family members have U.S. insurance, Canadian insurance, or some have none at all. So again, that question, if Mohawk Council of Akwesasne has the capacity to test entire families here in Akwesasne.
We have reported in the past, as we've moved along in this pandemic, that when we first started testing, it was you had to exhibit symptoms, you had to have been possibly exposed before you could go get tested. Now, where we are today is that the requirements are there are essentially no requirements. If you want to get tested, you have to call the community health nurses. It is by appointment only. They will set up a time in which you come by the drive-through testing unit, and they'll administer the test. I don't exactly know how many tests they can do a day, but if a family wants to come, the family needs to call the community health nurses. They will schedule them in individual time brackets, and they will be tested. If any other individual just wants to be tested because they feel that they want the sense of security for themselves to know that they're not carrying it, they can call them community health nurses. The one thing, though, is that they need to have a health card to be tested through the Mohawk Council. Now, the tribe does testing as well. So the individuals who may not have a health card but live in the southern portion of Akwesasne, they can make those arrangements through the Centers Mohawk Tribal Clinic.
All right, we're going to close the phone lines now. We'll be wrapping up in about 5 or 6 minutes. So I want to thank all of our callers for sharing the questions with us today and making the effort to participate in today's program. So once again, we're going to close the phone lines as we look to wrap up in the coming minutes. Another listener would like to know, why aren't home support workers being tested?
That I don't have an answer to. I would think that they are being tested, but we can look into that and find out if they had not been providing any services to clients or to the community for a while as a result of the pandemic. I do believe that has been reinstituted, but I think that they also are at the same time having limited services for now. And they also are observing all of the precautionary measures as well, going into individuals' homes. But we can get a bit more information on whether or not they have been tested before they go into homes.
All right, so another question. So far, the rules seem to be about Akwesasne community members and MCA employees. Are there any, is there any portion of rules or prohibition that's set up for visitors from other jurisdictions? For example, family coming in from other cities. So again, so far rules seem to be about Akwesasne community members and MCA employees. Is there anything for rules or prohibition of such set up for visitors from other jurisdictions, like family from other cities? What would the rules be for that? What would be the prohibition of allowing them to come here and things of that nature?
So essentially how the law is written, it says that any persons coming into the territory, into the community of the jurisdiction of the Mohawk Council needs to quarantine for 14 days. So if people are coming in, whether or not they're, from here or not, they should be quarantining. We really are, encouraging, we are really, discouraging people from inviting guests over to their home from outside of the community. We're not at that point yet. Again, we don't have any way of verifying who they have interacted with, what number of cases they may have in that area, how high risk they are. So for leisurely reasons, we really should be discouraging folks from coming in at this time. But all persons in the community of Akwesasne under the jurisdiction of the Mohawk Council are expected to abide by the rules that exist for our community, and that includes the need to quarantine for 14 days. Also, I will say too, though, that we have with the border restrictions as it exists now, we do know that individuals who may be in relationships with persons who are not from our community and may not be Indigenous are not able to cross the border. They're being turned back as well, unfortunately as well, for people who may be coming into the community, heading into Messina or other parts for wakes or funerals of some of our members who have been lost that are non-Indigenous are being turned back as well. So there are a couple of things that people need to consider, whether it's a safe thing to do, invite people here, and as well, are they going to be able to even cross the border to get to our community?
All right. Now, speaking of the border, Grand Chief, what are your thoughts? Is it going to be something that we'll see open up in 2 weeks? Do you think that the U.S.-Canadian border will reopen by July 21st?
We currently have a call every week with members of our council, the Southern Mohawk Tribe and the Mohawk Nation, with border officials from CBSA and U.S. Customs. That is a question that we continue to ask them. Those decisions are made in Ottawa and Washington, but looking at some of the political responses, as well as the in the media, there is a lot of concern how the United States is responding to the COVID-19, which I think just shows that Canada's response and the United States response is quite different, and that just highlights the fact that Canada may not be in a hurry to reopen that border now. Whether or not we'll end up in a spot where Canadians can go into the United States and Americans can't go into the other way, I'm not sure. So.
All right. So one last question on my end. The travel restrictions for the 50 miles, 80 kilometers, is that still in place for the Grand Chief and the district chiefs Are they still not going to be traveling outside of those areas for your activities that you conduct as council members?
Yes, that continues to still be in place. Yeah, they are expected to abide by the same rules as everybody else.
All right, that's all that I've got question-wise for you today, Grand Chief. I want to thank you for taking the opportunity to spend some time with us again this afternoon to give us those updates and also to answer questions from our listeners. So I will hand the reins over to you to close out with your final comments, Grand Chief.
Absolutely. So I just want to say that in relation to the question around the home support workers going into community members' homes. So the reason why they are tested for the long-term care facilities, it's a ministry requirement. Currently, there is no ministry requirement for that service to be provided, but they are wearing full PPE when going into homes, meaning that they have masks on, they have gloves on, that they're wearing gowns. So that is happening to protect them. But it is something that the health department has told me that they will review and see if that is, going to be something that a requirement will be going forward. Finally, Reen, I do want to say thank you again, Yawangoa, to you, Yawangoa, to the community for being patient over the last 16 weeks. This has been an extremely difficult time for all of us. And I do want to acknowledge everyone who has been doing their part. And we've talked a lot about the numbers today. And, I can't continue to reiterate enough that that's, by us taking all the precautions necessary to ensure that we are safe, our community is safe, and by keeping our numbers, low in the community as a whole. So Yamagoa to all of you for that. I do want to give a shout out as usual to our healthcare workers and our essential workers and our first responders who are working extremely hard to keep our community safe, and to our listeners again for doing our part. This is extraordinary times that we are working through. We must continue to take this day by day and know that we will get through this. We will look back on this and say, wow, that really was something, but it really is one day at a time. We need to continue to support one another and do our part to keep our safe. Yawa go Akwesasne, and Yawa to you, Irene, for today.